Hi there, I'm Dr. Martin Benfield, and this is a video for GP trainees who have just about to start or have just started their GP training, and it looks through a summary of the eportfolio. What I would advise is for you to have your eportfolio, the 14 fish, open, so that each time I talk about a certain bit, you can have a look at that and check you can open up and you can see what it looks like, you know how to find it. So first thing I'm going to talk about is the placement planning meeting. Now, most GP trainees start their first year doing hospital posts. Some people might do one GP post, but mostly it'll be hospital posts. And at the start, you'll have an induction, and then you need to organise a placement planning meeting with your clinical supervisor. So this is a meeting, might just be 20 minutes, half an hour long usually, and they might be able to explain any parts of the post that weren't clear to you at the induction, and you'll be looking to see if there are any learning opportunities during the post. So rather than just seeing lots of patients, can you get yourself at a clinic, or can you go to theatre and watch something being done? Can you spend some time with a member of the team that might be useful? And you'll usually be setting three kind of little PDPs, so not full PDPs, but three things to achieve during the post. And you'll also want to know, is there any maybe procedural skills that you would need to know, like being taught how to take blood in children or something else, something if you don't feel comfortable, is there something that you will need to know to be able to do that post? So that's the sort of thing you would write up, and then you would write up your own placement planning meeting report in your portfolio. The next thing to talk about are the learning logs. Now, the most important learning log is the clinical case reviews, and I will do a separate video talking about those and how to write those. And they are where you've seen one patient and you want to write up a review of what happened with that one patient. The second most common learning log are the supporting documentation. So that's when it's not one specific patient. There might be a summary of patients you've seen, but more usual would be you want to write up some learning you've done, say, from your GP training teaching afternoon, or some learning you've done, or some departmental teaching you've attended, and then you can write up that learning in your supporting documentation. These can be useful if you have set a PDP at your ESR, which we will get to later. Sometimes you might need to do some learning to prove that that's been done, and so you would do that in supporting documentation. Then the third type of learning log is something called a learning event analysis. Now, it used to be called a significant event, and this is where something regarding the patient care or something involving your working environment hasn't gone like it should have done. It doesn't have to be anything major. Nobody has to be seriously ill as a result, but maybe the patient was given the wrong medicine or discharged with the wrong medicine, or the handover wasn't done correctly, or a test wasn't organised. You have to be involved with this in some way. Ideally, you were the person that made the mistake and you corrected it, and in the write-up you have to explain how you will make sure this doesn't happen again, or try not for it to happen again. So if it wasn't you who did the mistake, you have to at least be involved with correcting it, because you have to be able to be in that person's shoes and say, this is how it's not going to happen again. The next set of things are the workplace-based assessments. Now, there are a few different types of these that need to be done in ST1, and they will usually be either assessed by or marked off by your clinical supervisor. The assessments can be done by a senior in the team, ST4 or above, as long as they've had some training in using the 14 fish eportfolio. First thing is mini KEX. So have a look at this on the eportfolio now if you can. And a mini KEX is where you are assessed by a clinical supervisor or senior doing a part of a consultation. So taking history, examination, explaining a diagnosis, explaining a management plan. So a section of the consultation is witnessed, and then either if it's your clinical supervisor, they'll have access to your eportfolio and they can write up the assessment, or if they're not on your eportfolio, you can send them via 14 fish, an email can be sent with them with a link to do the assessment. you'll see if you look carefully, it says mini kex stroke cot. Now, a cot is the same within the same group, but that's when you're in a GP placement, you would do a cot, and that's the whole consultation from start to finish. Case-based discussions are where it's not a debrief of the case. This is where you take a case to your clinical supervisor and maybe spend 20 minutes, maybe even 30 minutes discussing the case in detail. And the aim is for them to keep probing your knowledge to the point where you can't answer any more questions. So why did you think it was that diagnosis? What else could it have been? What other data could you have looked for? What does this test result mean? Why did you choose that dose? So it's sort of probing your knowledge, understanding of the case. And then they would write that up, do the assessment as a case-based discussion. Next one is multi-source feedback. So you need one of these in one of the posts in ST1. Now the ESRs, the reports, get done in November and May, so it has to be done in one of the first 2 posts. So it has to be done before May. And the aim is to have at least 10 people do an assessment of you, how you performed in that post. And it needs to be some people who weren't doctors or nurses, so maybe a bed manager, social worker, some ward admin staff. And what you do is you get email addresses for all these guys, and then you send that off via 14 Fish, and they do an assessment of you. The other workplace-based assessment, which isn't obvious on the ePortfolio, is something called CEPS, Clinical Examination Procedural Skills. And this is where a clinical supervisor or senior assesses you doing an examination. Now, there are no annual targets, but there's quite a long list of ones that you need to have been assessed as competent with by the end of your training. So the aim is to do a few intimate examinations assessed and a few non-intimate examinations. Now, what you manage to do in each post depends on the post. So, for example, if you're doing psychiatry, you're not going to get any intimate examinations. If you're doing obs and gynae, you would have expected to have done a pelvic exam and a speculum exam, for example. So if someone watches you do an examination, don't get them to mark that as a mini kex. Get them to do that as a CEPS. At the end of your post, you're going to need to do a clinical supervisor's report. So this is where your clinical supervisor has a meeting with you and does an assessment on your ePortfolio about how you did, and you need to make sure this is done before your November ESR. If you look at the workplace-based assessments list, there are a few things on there that you don't need to do this year. So there are a few that are ST3 only, and they include the patient feedback, leadership project, and also leadership project colleague feedback, and the prescribing assessments. You can forget all about those if you're in ST1. You will see there is the quality improvement work. So this is the QIA, Quality Improvement Activity, and the QIP, Quality Improvement Project. Now, the project is done in a GP post. So usually most trainees will do it in ST2. So in ST1, you need to do one QIA, Quality Improvement Activity. And this is anything that improves your work environment or patient care in some way, so outside of your own personal learning. So it could be something about your own personal improvement. So it could be an analysis of how well your referral's done, or you could look at all the patients you admitted for a week and then see what happens next, and analyse whether there are any trends, is there anything you need to improve. It could be part of, say, a medication monitoring or some kind of guidelines. Are your team or are you following guidelines properly? It could be something in the working environment. So how well does handover work, or how well does your team liaise with another team like social workers or radiology, something like that. You could be part of a bigger team audit, but if you did that, when you do the write-up, you have to make it clear what you did, because the point of doing this is to show that you know how to make an improvement in your working environment. So you have to be able to show that in your write-up, not just show you can do a search. You have to be able to do the whole section. The project is a bigger thing and tends to be a full, so if it's an audit, a full cycle audit, so you have to prove and have a look, see how your changes helped and analyse that. It has to involve other people as well. So for example, if you improve or aim to improve how a medication is monitored, you have to liaise with the people who will be using it after you finish. So maybe the pharmacist at the practice, the other doctors, that kind of thing. The ESR is the Educational Supervisor Report, and these happen in November and in May, and I will do a separate video talking about how you prepare for your first ESR in November. So we'll have a look at that. And you might have heard of something called the panel. The panel is where the deanery look at your ePortfolio after the May ESR. So again, you don't need to worry about that. That happens all by itself. Okay, I hope you find that useful. Have a play with the ePortfolio. Have a go with adding the clinical case reviews, because you can't really learn this just by listening to me here or reading anything. You've got to have a go and try it for yourself. Okay, thanks.